Jack, she promised you she'd build a yellow castle for you. She would sing a lullaby that shooed the ghosts away. She always wore your yellow socks with her red shoes. Then she walked to the coffee shop.
After I had my shower, I started my day by doing some revision using an amazing resource called Clinical Key, which is an Elsevier product who are the kind sponsors of today's video. Clinical Key is a program that many universities subscribe to, so if you're not sure if you have access, make sure to check with your librarian. It gives you online access to loads of the highly recommended textbooks, all in one convenient place. Personally, I've been using Clinical Key to try and revise my understanding and interpretation of ECGs. So to do this, I've been looking at very common presentations and trying to note down the rate that I can observe and the issue and diagnosis that I think is present, and then I suggest a management plan. I then look at the textbook to check the answer, and I read around any queries that I might have.
Used to dance with you in the clouds. She told me.
Good morning everyone, welcome back to my channel. If you're new around here, my name is Olivia and I am a 4th year, how did that happen, medical student, studying in London. And I was thinking recently, I really miss doing a day in the lifestyle videos. I think they're my favourite to film, and so I thought because I've started this year, it might be nice to show you what 4th year looks like in comparison to all my other years I filmed. I have so much to update you on. This year is so different to any other year, so bear with me whilst I try and explain what this year even looks like. I've had a lot of you guys asking how I am and how I'm finding medical school, so I thought this video would be a great way to answer all those questions and bring you along for a day on placement. So I'm now in my 4th year, and in your 4th and 5th year at my university, you're pretty much exclusively on placement. So what my week looks like is I'm on placement on Monday, Tuesday, Thursday and Friday, and then on Wednesdays I have some time set aside for me to do some project work. So in our 4th year we have to do something called a quality improvement project, where we identify something that's not going quite right in a clinical setting and we try and come up with solutions as to how we can improve that. It's very full on being on placement so much, but I'm learning so much, and I feel like as I really got stuck into clinical years, I'm enjoying medicine a lot more. Although I still feel like I get in the way a lot of the time as a medical student, I'm starting to feel a bit more like I have more knowledge and I'm more valuable to the team. So that's been a really nice feeling. So in our 4th year we have 4 blocks which are each 8 weeks long, and we rotate around those blocks. So the first one I was allocated is psychiatry, and that is what I'm currently on, and then I move on to emergency medicine and critical care. Then I move on to women's health, which is basically obstetrics and gynecology, and then I move on to pediatrics. So in our 4th and 5th year, it's really about getting stuck into different specialties, and I'm trying to take it seriously because when I think about it, this is the last time I'm going to do, you know, a psychiatry placement before I'm a junior doctor and seeing patients presenting with psychiatric issues, for example. So I'm really trying to absorb as much knowledge as I possibly can. And then in addition to that, in your 3rd year at my university, you basically choose where you want to be in the country for your 4th and 5th year. So you have the option of staying in London. You can stay in London and then go out in what we call the periphery, which is where you're sort of on the outskirts of London, or you can choose to be exclusively in the periphery. There are advantages to all of them. I would say, you know, some people have family in London, so they want to stay here. But personally, I wanted to go in the periphery because you end up staying in hospital accommodation, which, you know, is not the most glamorous accommodation, but your rent is paid. So I made the financial decision that I wanted to go to the periphery. And basically you're given a random ballot number, and where you rank in that ballot number determines how likely you are to get your preference. I was really fortunate and got my first choice. So how my placement has looked this year is, for my first block of psychiatry, I've been located in London, which has been really nice to kind of ease me back into the year. And then I pretty much move on to being exclusively in the periphery for the remainder of my medical school journey, which is crazy because I'm literally like my time in London is over, which is really, really sad. But I wanted to go in the periphery because I've experienced busy central London hospitals. The patient cases you see are often really unique, and I'm really privileged to be able to see such a multitude of presentations. But I feel like with it being busy, it's often difficult to kind of get stuck in and learn new skills because, you know, the clinicians are all just so busy. So I kind of wanted to go into the periphery with the hopes that it would be a little bit quieter, dare I use that word, so that I could just get a bit more hands-on experience and I wouldn't feel so rushed off my feet. So I will be moving into hospital accommodation in the next 2 weeks, and I'm going to take you guys along with me to detail how that is. Anyway, let's move on to talking about what I'm up to now. So I'm actually in my last week of my psychiatry block, which is crazy. It has flown by. And as part of my psychiatry block, I spent 4 weeks with the older adult community mental health team, and then I'm currently spending 4 weeks with the forensic psychiatry team. So I've really had a varied placement, and that's been really, really helpful for my learning, and it's just kept things really interesting. Today I have a sort of hybrid day, so I've got some self-study time in the morning, and I've also got a tutorial with my consultant, and he just talks us through different presentations and, you know, pharmacological management. So that is super, super helpful. This morning I did some self-study by looking at some ECGs, as you guys saw, because reading ECGs is something that's really common in a psychiatry setting because a lot of drugs that we prescribe can alter the electrical activity of the heart. So it's just important to monitor that and make sure the heart is nice and healthy. And then after that, I'm going to be heading into placement, and things I get up to on placement really vary. So sometimes I'll be part of a ward round, which is where we discuss new presentations, or we discuss patients and we see how they're getting on, how they're responding to a certain treatment, what their general mood is like. Sometimes I'm part of a discharge planning meeting where we discuss the discharge of a patient and the things that need to be in place to support them in the community. In a psychiatric setting, we're often taking bloods to check how people's electrolytes are and check how their blood count is doing. We check their heart by looking at ECGs, like I mentioned. So there's lots to be getting on with, and alongside this I have a lot of portfolio work. So in general on placement, I'm seeing patients, I'm seeing how their mood is, and I'm writing case reflections on these because that's really helpful for my learning. So yeah, we've got a lot to be getting on with, so let's get on with the day. Hi, good morning. I then had my morning tutorial with my consultant where we spoke about somatic disorders before heading off on the very long commute to hospital. Whilst I've been on my psychiatry placement, I've really been having to revise my neuroanatomy. What I've been doing is using the Complete Anatomy app whilst I've been on my commute to hospital because it is quite a long way away. The Complete Anatomy app is an Elsevier product and I absolutely love it. It is just the most incredible bit of software. You can download it to your phone. So it's an app where you can look at various different body parts, different bones, different structures, and you can rotate them with your fingertips. You can get rid of layers, you can add layers, and there's plenty of description to remind you of muscle insertions, nerve roots, and the general function and action of these muscles. I also love this app because there are plenty of courses you can get stuck into and lectures that are helpfully uploaded. So there is just so much you can look at on this app, so I really, really recommend you download it to help you with your anatomy revision, especially if you're in your preclinical years. After a very decent bus anatomy revision session, I finally arrived on placement and began to walk to the hospital, marvelling at this lake from a leaking drain. So I'm just walking to placement now. I've been in a lot of traffic, so I'm kind of surprised I made it on time. Once we got to the hospital, I joined the doctors in checking on any patients that we had any concerns about, and then for any interaction I had, I made sure to document my notes. So in a psychiatric setting, you might be particularly concerned about any noticeable changes in mood. And then after that, I helped the nurses perform some routine blood examinations and looked at the results of these. And then I put this morning's ECG revision into practice and did a few of the patient ECGs and had a go at interpreting them. After all of these tasks were complete, I headed home for a well-deserved rest, and I even managed to catch a gorgeous sunset on the way home.
She's sorry for all the promises.